Have you ever thought, what if I need an induction or a C-section, or perhaps something you haven't even heard of yet? Let's take the mystery and the fear out of birth interventions so you can walk into labour feeling prepared and not panicked. Now, in my previous videos, we've talked about the stages of labour, the role your hormones play, and how to know when it's time to go to the hospital. Now it's time to explore something that brings up a lot of questions, and that's medical interventions during labour. So you've probably heard stories about epidurals, inductions, assisted deliveries or emergency C-sections. And maybe you've wondered, will I need one? Will I still have a say? And is it safe? Now here's what I want you to know. Some interventions are necessary and life-saving. Others are more routine and sometimes avoidable with the right support. The key is understanding what they are, why they're used, and when you actually have a choice. And by the end of this video, you'll feel more confident about what might happen in the birth room and more prepared to ask the right questions and advocate for the kind of experience you want. So let's dive in. First of all, what exactly are birth interventions? So, interventions are any medical procedures used to assist labour and birth. That could mean starting labour, managing pain, or helping a baby out if labour isn't progressing. Sometimes they're absolutely needed, and sometimes they're suggested out of habit or for convenience. Your job is to understand what's being offered and why, so you can make decisions from a place of clarity and not fear. Now let's talk about inductions. So induction means starting labour artificially rather than waiting for it to begin on its own. It might be recommended for medical reasons like preeclampsia, gestational diabetes, or signs of infection. You might also be offered one if your water breaks but contractions haven't started, or if you're past 42 weeks. There are a few ways this might be done. Some doctors use synthetic oxytocin, you might hear it called pitocin or syntocinon, to kick-start contractions. It can be effective, but it also tends to make contractions more intense, which often leads to an epidural. Other times they might use medication or a device to soften your cervix before labour really begins. This is called cervical ripening and could involve prostaglandins or a small balloon catheter. It's gentler, but it can still be uncomfortable or lead to irregular contractions. There's also the option to break your waters manually. This is called an artificial rupture of membranes. It's done to try and speed things up, but once your waters are broken, the clock starts ticking and the risk of infection goes up if labour doesn't progress. If your care provider suggests an induction and there's no urgent medical reason to move quickly, you could ask about trying natural ways to encourage labour first. So gentle movement like walking, nipple stimulation, staying well rested, or simply giving your body more time can help kickstart labour on its own. In many cases, these methods are enough to get things going without the need for medication. So remember, unless there's a medical reason to act quickly, you can choose for more time or explore gentler options. Now let's talk about pain relief and what your options are. So pain relief during labour isn't a one-size-fits-all. It's about finding what works for you. Now I'm going to start with the epidural. It's the most common form of pain relief. It's a numbing medication that blocks pain from the waist down. It can be absolutely amazing if your labour is long or overwhelming, but it can also slow things down. It can limit your movement and increase the chances of needing other interventions. Then there are IV medications like morphine or fentanyl. These don't numb you completely, which means you can still move around. They're often used in early labour to take the edge off, but they can make you feel drowsy or dizzy, and they do cross the placenta, which means baby might be a little sleepy after birth. If you're looking for pain relief but want to avoid an epidural, nitrous oxide, which is also known as laughing gas, might be a good option. It's inhaled through a mask during contractions and can help you feel calmer and more in control. When combined with deep, steady breathing, many women find it helps them stay focused and manage each surge with more ease. Alongside medical options, there are also natural comfort measures that can make a big difference during labour. Techniques like deep breathing, swaying or rocking, getting into warm water, using a birth ball, or having your partner apply counter pressure to your lower back can really help your body relax and help you cope with contractions. These tools work best when used early and often, helping you stay grounded and connected to your body throughout labour. Here's the key takeaway. So pain relief is not about being strong or natural enough. It's about what helps you feel safe, calm, and in control. You get to choose what that looks like. Okay, now let's move on to when baby needs a little extra help. So sometimes, even when you've done everything right, your baby might need extra support to be born safely. In some cases, a suction cup can be placed onto baby's head, and that will help guide them out as you push. That's called a vacuum extraction. It can be really effective when baby is right there but not quite making it on their own. It might leave some swelling on your baby's head, but it usually goes away quite quickly. Forceps are another tool. They look like big tongs, and they are used to help pull your baby out if they're stuck. They're really effective, but they do carry a higher risk of bruising or tearing for both you and your baby. And then there's the C-section, which is a surgical birth where baby is delivered through an incision in your abdomen. It can be planned or happen after hours of labour if things aren't progressing, or if baby shows signs of distress. The recovery takes longer, and it does come with more risks, especially for future pregnancies, but it can be absolutely the right call in the right situation. Now, if you're faced with a decision about an intervention like a C-section, it's okay to pause and ask why it's being recommended. Understanding the reason behind it can help you feel more in control, even if it wasn't part of your original plan. When you're informed and the decision makes sense to you, that's a strong sign you're making the right choice for you and your baby. And that's the point. Whether it's vacuum, forceps, or surgery, ask the questions. Stay involved. Remember, it's still your birth. Now, let's get a little practical. Okay, so I want you to take a minute and create your birth preferences plan. So this is your space to think it through. What interventions are you open to? What would you like to avoid if possible? What questions will you ask before saying yes? And who do you trust to speak up for you if things get intense? Now I want you to write it down, talk it through with your birth partner or your doula. The more prepared you are, the more calm and confident you'll feel when it matters. Now here's the main things I want you to take away from this video. Not all interventions are bad, but not all are necessary. Knowing the difference puts you back in control. Asking questions doesn't make you difficult, it makes you informed, and remember, you have the right to say no to anything that's not an emergency. Now that you know how to navigate medical options, the next video is all about the natural side of things. So we'll be talking about how to use breathing, movement, water and environment to stay comfortable and confident throughout labour, whether you're planning an unmedicated birth or if you're blending techniques. And if you haven't subscribed yet, hit that button. These videos are here to support you, not just with information, but with calm, grounded guidance you can actually use. You've got this, and I'll see you in the next video.